So I'd like to move on and introduce Laura Pegram with the National Alliance of State and Territorial AIDS Directors. The Drug User Health Program, which Laura manages, I think has been around for a number of years in response to some of the trends that we've been seeing for a while. And just want to also note the leadership of NASTAD, her organization, in working with HIV/AIDS directors as well as the hepatitis coordinators in every state that Dr. Merman mentioned earlier. So excited to hear from Laura. Are you on the line?
Yeah, I'm here. Can you hear me okay?
Great. Go for it. Thanks.
Cool. All right. Good afternoon, everyone, and thanks to Karina and Rich for inviting NASDAQ to present and share our work and reflections on the state and jurisdictional health department response to the opioid crisis. Go ahead and slide. All right, so just a little bit about NASDAQ. We're a nonprofit, nonpartisan, national membership-based organization. We founded in 1992. We work with all the statewide health departments that administer HIV, hepatitis, and drug user health programs. And like I said, we do that in all 50 states, U.S. territories, and federally funded jurisdictions. Our aim is to end the intersecting epidemics of HIV, viral hepatitis, and related conditions by strengthening domestic and global governmental public health through advocacy, capacity building, and social justice. Recognizing the inextricable links between people who inject drugs and transmission of HIV and hepatitis, NASDAQ has always supported state-level efforts that focus on the health of people who use drugs. We've worked with states to develop programs aimed at reducing transmission risks among this group, and this work has scaled up for obvious reasons in recent years, as Karina mentioned. Like she said, I'm the manager of drug user health here at NASDAQ, and I work specifically with state and viral hepatitis programs around their efforts to support people who are using drugs and who are at this increased risk. So now when it comes to state-level responses to the opioid crisis, it's important to recognize the incredibly huge diversity we have among all of our states, territories, and jurisdictions. The ways the opioid crisis has hit these different places and regions is as diverse as those places themselves. Additionally, each state and jurisdiction operates in very different social climates and have very different histories and level of engagement of working with people who are actively using drugs. In turn, to adequately meet the needs of these diverse communities, the responses, tactics, and strategies will also have to be incredibly unique and diverse. Slide. So as NASDAQ supports health departments in their efforts to reduce harms and prevent HIV and hepatitis for people using drugs, several themes seem to continually come up in my work. These are things that I hear consistently from state health departments and programs and staff, and they often center on, one, the need to change the dialogue and often public perception around who is using drugs. Two, questions about who should be working with these individuals. Three, the best way to reach these individuals. And four, questions surrounding what are the best ways to respond to this crisis comprehensively. Now, in relation to the opioid epidemic, we often hear only about either A, the prevention of use of drugs, or B, access to treatment as primary strategies. But we all know it's a lot more complex than that. People who are using drugs are first and foremost people, and in that they're incredibly complex and present with a lot of potential issues that need to be addressed to support their health. These needs can be anything from mental health to housing to infectious disease and overdose prevention, and we're going to have to create programs and services that address this whole range of services in order to comprehensively address the crisis. Put simply, you really can't address infectious disease without addressing overdose. You can't address treatment for substance use disorders without talking about safer current use and personal stability. You can't address overdose without supporting the general health of active drug users, et cetera, et cetera. This list could really just go on and on. So all of those things are inextricably connected. And unfortunately, our responses don't always reflect that. Often they have remained siloed, especially in the past. So health department programs working on the infectious disease consequences of the opioid crisis are uniquely situated to address this comprehensive health, the comprehensive health of people who use drugs, since they often need to be focused on just this gray area, the area between prevention of use and treatment for substance use disorders. This is where folks are most at risk for contracting HIV and hepatitis, and this is where health departments have had to increase focus and often refocus their programs. So in order to do this, these programs have had to adjust what their outreach and infectious disease prevention efforts look like. This includes working with people who are actively using drugs to identify behavioral risk factors and helping to provide tools to reduce risks among these individuals. This often includes starting or strengthening syringe access programs and partnering with community-based harm reduction groups that have been doing this work for a long time and have that expertise already. Often health departments need to find ways to make their own staff and programs more culturally competent in their work with people who are using drugs. They need to work to reduce stigma surrounding drug use, both within their programs and the larger community. And they need to expand services to include education and information about safer drug use that is relevant to their community. This includes learning about the range of drugs that are actually being used in that community, their transmission risks, and how to work with people using drugs to reduce those risks and support health in a non-judgmental way. Slide. Thanks. So now, like I mentioned, every state and jurisdiction is totally different in regard to their work with people who use drugs. Some have had programs focused on harm reduction for years, and others are just starting out, and some are just beginning to start thinking about starting out. So like I said, there's a really big range here. And this diversity of states means that there are often a lot of challenges in implementing these programs because, as we all know, there's no one-size-fits-all solution, and that's not going to work for different states. This diversity also means that there are a lot of opportunities to share lessons learned. Basically, there's a wealth of knowledge and experience to share between states, and every place can learn from the experience of others, regardless of where those programs are at in their progression or development. It's also important to recognize that there's a lot to be learned from people who are using drugs. These individuals are expert in their own lives and really the most important partner in creating a comprehensive response to the opioid crisis. Health departments have learned they need to meet people who use drugs where they are in order to effectively address anything. So states are working to create this comprehensive response. Some of the lessons learned that seem to come up a lot often focus on collaboration. I know it sounds really cliche, but collaboration is totally the key to successful programs. And this has been mentioned before here today, but we know that the opioid crisis and infectious disease transmission risks related to it are incredibly complex. And because of that complexity, the funding and resources to combat this crisis are often spread between agencies. Think about injury and prevention, single state agencies, health and behavioral science services, and infectious disease programs. Each of those agencies has a different piece of that puzzle and are going to have to find ways to work together. States are trying to be really creative around funding. In some places, this includes creating an Office of Drug User Health that coordinates statewide efforts and tries to unify that funding, partnering with other departments to support efforts around this issue, and collaborating around services that are offered to better reach this group. One way we often see that play out between different programs, community-based organizations, and departments is about co-locating services that support drug user health in one place. Several states refer to these programs as syringe service program hubs, either as platforms for services or as implementing, say, a hub and spoke model, where SSP programs are often the primary hub and the services are the spokes. And like I said before, there's often a wealth of experience among community groups and organizations who already work with people who are using drugs and work to reduce drug-related harms within this community. It's really vital for states to starting this work to partner meaningfully with these groups. Often this means helping to fund or support these community-based programs and finding ways to, again, collaborate, not necessarily duplicate efforts. And of course, it's vital for states to share resources, successful strategies, and effective program models to adequately address this crisis. In my role at NASTAD and at NASTAD in general, we try to be that bridge for health departments. Slide. So lastly, I just want to give a really quick rundown of the ways NASDAQ can help state and jurisdictional health departments and some of the activities we have been working on. In terms of technical assistance, a big part of my role is about working with states to talk through and assess what's happening on the ground for them, basically what they're seeing, hearing, feeling in their communities, providing ideas and guidance about program implementation, resources, and collaboration, and working to troubleshoot, problem solve, or brainstorm around issues and barriers as they come up. And NASDAQ in general works to create resources about effective or innovative programs, policies, and activities that hopefully are useful to other areas based on the experiences of state programs. These are delivered in a variety of formats, such as reports, webinars, work group calls, learning collaboratives. So if you have questions about any of our resources, including mine, feel free to reach out to me or any other NASDAQ staff, or check out our website. We are also part of the CDC Capacity Building Providers Network, and we create and deliver in-person trainings for health departments and their community partners who are working with people who use drugs and reducing infectious disease within that group. These trainings can be requested through state and territorial HIV and hepatitis health department programs and are delivered at no cost. And lastly, just at the bottom there, I went ahead and included some links to some of our drug user health resources. First, the link to our page, our program page, our resource, Maximizing Health, Minimizing Harm, Incorporating a Drug User Health Framework, Modernizing Public Health to Meet the Needs of People Using Drugs, and our recent call to action for health departments and community stakeholders in support of supervised injection facilities. Slide. So the last slide is just my contact information. Please feel free to reach out to me at any given point, and I look forward to the questions later. Thank you for your time.
Thanks so much, Laura. We really appreciate your work and that of your colleagues at NASTAD. I really appreciate your time today. And so hopefully everybody's caught Laura's invitation to contact her directly for more information.
Produced by the U.S. Department of Health and Human Services at taxpayer expense.